Hello everybody and welcome back to Insight 2022. My name is Joshua Smith. I'm the agency director over here at Neishloss Fleming. I'm very excited today to bring you some of the great insights on Hartford, Connecticut in the overall Connecticut market for 2022's AEP. So jumping right into the market overview for Connecticut, there are 697,801 eligibles for Medicare in the state of Connecticut. 185,767 of which are dual eligibles. That's a huge opportunity no matter the which way that you slice it for folks that are Medicare eligible or D-SNP eligible as well. There's a huge market for Medicare in New England in general, but specifically in Connecticut. 2% is growing year over year as far as eligibility is growing. So more people every single year, it's certainly as we look towards next year, there's going to be more people next year eligible than this year. Medicare Advantage penetration is 48.1%, which is one of the highest that I've seen across the entire United States. 48.1% of the population of Connecticut that is Medicare eligible are choosing Medicare Advantage coverage. That's an amazing opportunity for any MA agents that are out there. Specifically for MA enrollment growth, that is also growing at 9.3%. So in what was a very Medicare Supplement focused market, especially with that non-existent underwriting, Medicare Advantage is something that more and more your clients are choosing. Today's insight, we're going to be talking about the Medicare Advantage market dynamics in Hartford. We're also going to be talking about what happened in AEP 2021. We'll talk about some key changes to key plans for 2022. We'll also review some plans to watch, and I'll go over some closing thoughts with you as well. So the Medicare Advantage market dynamics in Hartford, Connecticut. So there's a few national carriers that we're going to be talking about today. That's going to be UnitedHealthcare, Anthem, and CVS. There are some local carriers that you will be on the lookout for, and that's going to be the Emblem Health / Connecticut. But the name of the game for 2022 is growth. All carriers are going to be gaining that Medicare Advantage business. It's a huge year for Connecticut, and we're going to be doing a ton of business with all of you for 2022. So what happened in AEP 2021 to gear us into 2022? Well, the overall market is still growing in Medicare Advantage. We've got 10,600 new members from October 2020 to April 2021. The biggest movers and shakers are going to be UnitedHealthcare. You see that they have the lion's share of the clients that are in your Hartford, Connecticut County. Following that up, you've got Aetna, Connecticut, Anthem Blue Cross, and then we'll round it off with the WellCare product as well. So specific to UnitedHealthcare, UHC plans are losing some of their top membership, but they're steadily gaining for that Walgreens PPO that started. They're continuing that trend from last year to really elevate that growth in this plan. So that plan 2, you'll see it lost a little momentum this year, as did plan 3, but they grew so much with that Medicare Advantage Walgreens PPO. But across the board, slightly red, but it more than makes up to it for that Walgreens PPO. Specific to Aetna, Aetna continues to grow that elite PPO membership. There is going to be a membership migration from the $99 value plan, but right here you're going to see a ton of growth that was already in that elite plan, and there is some plans that lost a little bit of momentum through Aetna as well. So what happened with Anthem? Well, Anthem's been slow and steady. Consumers are happy. There's been some growth in the new MediBlue Access Select plan. Anthem actually saw a ton of growth in their dual special needs offerings as well. I don't believe I have it on this specific slide, but they really do have that focus for their dual client space. So what happened for the top plans from last year to this year? So on October 1st last year to April 1st of this year, UnitedHealthcare, their dual PPO completely blew up. They've got 3,000 plus memberships that they've added over the course of those months. And not just because they switched during AEP, but OEP really helped out with that as well. Just being able to sell SEPs across the entire year really bodes well for the advancing of more dual special needs opportunities for you and any of the other agents that are out there. Aetna also grew for that elite membership as well for their PPO. United Healthcare Advantage Plan 2 and Plan 3 following each other very subsistently. And then Anthem, AARP, and then we've got the Connecticut plan to wrap out the top plans where they were from last year to where they are this year. So what happened in the AEP as far as the growing plans? So here we see United Healthcare for that dual membership. Again, those D-SNP sales are out of this world. They're really gaining almost 3,000 members for that market. The Walgreens plan also grew tremendously. So that's 2 straight years of the Walgreens plan really trying to catch up to the membership of the plan 2. Aetna, they launched that D-SNP last year, which grew almost to 1,000 members, followed by their Elite PPO, which grew by 615, and then Anthem was also in the top 5 for membership growth as well. So what are some of the key changes to some of those key plans for 2022? Well, for Aetna specifically, there is a new plan that's coming out this year, and it's called the Essential Elite PPO. This was built beside the current Elite plan to offer an alternative to the inpatient hospital copay. So what Aetna is really trying to do with this particular plan is hear your voice for the agent and figure out a way to combat the inpatient hospital per stay. So right now it's $795 per stay, but they want to give you an alternative. They want to give you the $175 per day, days 1 through 5, which is, if hospitals are trying to kick their patients out faster and faster, as we've seen, this might be a really viable alternative to save some of your clients some dollars this year. And it's got the same $1,000 deductible. This one does include a hybrid dental program too. And so for what that means is you can use the Aetna PPO Dental Network to get $1,000 of benefits covered right out of the gate, or you can use your own dental network as a client. You'll pay up front, then submit the statement to the address on the back of the ID card, and then they'll be reimbursed 50% up to that $1,000. The Essential PPO is still around, so they're not eliminating that plan, and they're not looking to move the bulk of everyone to that new plan as well. They're really looking to make an alternative for any of the existing members or the future new members as well. If you do need additional support for any of the Aetna resources, all of the broker managers are there for you specifically. If any of your clients do move to the new plan, you should still be agent of record at the end of the day, so that should not affect any of your commissions or your renewals as well. As far as their D-SNP goes too, they did some additions on that. So it's now they will accept 200% of the federal poverty level that now qualifies, which is more possible prospects for you, especially in an environment where we saw so much growth for the dual special needs and some of the other carriers. This is a huge boon for Aetna. They're also including a $30 per month food card that works at Walmart, CVS, Walgreens, and Stop & Shop. And they also do have the $90 per quarter for over-the-counter. Key changes for United Healthcare. Well, stability is the name of the game for United. Always has been, always will be. Stable benefits and some positive movement. Co-pays, deductibles, and line items are pretty much the same as they were last year, or a little bit better. Dual special needs, one of the really great things that I love what UHC did this year for their D-SNP is they combined their over-the-counter and healthy food benefit. So now everything is isolated into their one membership card. So they don't have to go through their wallets or their purses trying to dig out 3 to 4 different cards for going to the doctor or using their over-the-counter benefit or using their healthy foods. Everything is housed into one key location. That's super easy. They also do offer additional eyewear allowance, personal emergency response service, and some additional hearing aid benefits as well. For Anthem, MediBlue Access Select. This is the new plan H2836005. This plan went from $24 and now it's $0. $750 for their out-of-network deductible, but they're also offering some additional allowance on grocery cards so they can spend on healthy food items. They're also offering a new plans with the insulin savings program that we saw into the market last year. So that $35 copay through the donut hole, through all of your coverage, is going to be covered with some of these Anthem plans as well. But they did also offer the new PPO D-SNP to their network this year too. So some key plans that you're going to be wanting to watch this year. For United Healthcare, Walgreens plan. It was one of the top movers the last 2 years. There's no reason that it's not going to continue to do great this year. Huge network with doctors, over 1 million doctors in their national network. That's going to be huge for any of your clients that are looking to, go down south as a snowbird to visit, your Floridas, your Californias, your Texas, or the Carolinas. This is going to be a great opportunity to say, hey, there's 1 million people in this network. If you are going somewhere, we're going to find someone in network for you. $0 co-pays, tiers 1 and 2, even during the coverage gap. New hearing aids every year, so you don't have to wait that buffer year like we've had to do in the past. So now new hearing aids every single year. For the dual special needs market, you're looking at huge growth from 2020 to 2021. You gotta capitalize on this market. There's an incredible opportunity here for any agents that's willing to work with the underserved folks in the Connecticut market, folks on Medicare and Medicaid. This year that they've also, they're now offering emergency services. So think of it like as a life alert system for any of your clients. They fall, can't get up, no help around. They'll be able to press a button and an ambulance be launched their way. As I mentioned earlier, OTC and healthy food in one card makes things a lot simpler for your clients, makes them want to utilize the benefits as opposed to hunting through 4 different cards to get their benefits that they need. For Aetna specifically, let's talk about the new version of their Elite PPO. Again, it's similar but expansive in some of their benefits. Same $1,000 deductible, moving to a per day for the inpatient stays. So again, that's $175 per day, day 1 through 5. Clients that are calling Aetna specifically to switch will remain agent of record under the current agent. There's going to be that hybrid dental plan as well. Again, $1,000 covered if you're using the Aetna coverage network, or you'll get that $1,000, 50% if you go outside of that network. So that's going to be a great opportunity for Aetna, so be sure to make sure that you're watching this plan as well. So for Anthem, you're going to be looking at the MediBlue Access Select. They dropped the premium down to $0. They dropped the deductible down to $750, and that also includes $750 deductible for the PPO. So this plan is going to be an amazing opportunity for, a great opportunity already exists for Anthem. They're just sweetening the pot, making the plan much more affordable from the $30 premium down to $0, and creating that $750 deductible is going to be a huge opportunity as well. Keep in mind dual special needs and the MA only plans. United Healthcare, they're the biggest mover and shaker in the dual special needs market. You got to be able to have that plan in your portfolio if you're doing any DSNP sales. Clients that love it, they're also going to be a great referral source for you too, so don't neglect them. Aetna, for their DSNP, again, 200% of the federal poverty level now qualifies for this plan. More opportunity with more clients. Requested improvements, you've been heard. So you don't like the per stay for the hospital, so we wanted to give you an alternative with Aetna. So that opportunity is there for you. Additionally, $30 per food card and then $90 per quarter for OTC. Anthem, they've got that new DSNP plan with $100 per quarter, unlimited podiatry visits, and $3,000 max on their hearing aids and services. So some closing thoughts for Anthem. As always, doctors and drugs are going to dictate the bulk of your movement for this AEP. If the docs change or the prescriptions don't change, those are really going to be the deciding factors if your clients are going to want to move. If they're happy, great. If they need to move, put them onto a new plan, but focus, there's not a whole heck of a lot of disruption in your market this year outside of the Aetna, but for your current clients, make sure that they're happy. The new Aetna Premier plan is going to shake things up, so you want to be proactive too. Work with the local teams, work with us here at Neishloss and Fleming. If there's anything that we can do to help these adjustments go smooth, we will do that for you. Additionally, Medicare Center, Medicare Center, Medicare Center. Keep all of your enrollments in one place. It's the one-stop shop that you're going to need to make any of your enrollments this year go as smooth as possible. Don't forget that there's text to enroll, text to scope of appointment, email for both as well, but just being able to sell your clients that know and love you already without having to be face-to-face is going to save you so much time this AEP so that you can have a very successful one. That's about it for me for today. I want to thank you all so much for joining us here today. If you need anything, please don't hesitate to reach out. I really appreciate your partnership, and if you need anything, we'll be in touch. Thanks again. We'll talk to you soon.